But good morning, everybody. Thank you so much for coming. I'm Dr. Irene Herford. I'm the board chair of Mental Health Partnerships. It's such a pleasure to welcome you all to the launch of our 2025 Impact Report. Today, you're going to hear about how MHP built on 75 years of hope with a year of momentum, growth, and measurable impact. This morning is a chance to reflect on what we've accomplished together, the people that we've helped, and the difference we've made across our communities. It's also a moment to look ahead to where we're going and to how we continue to build on that progress. From my perspective as a board member, what stands out most is the strength of this community, people coming together around the belief that recovery is possible and that everyone deserves support, dignity, and connection. Thank you again for your partnership and for being here today. We're going to begin with a brief overview of our impact, followed by a look ahead and time for discussion at your tables. And now it's my pleasure to introduce our President and CEO, Dr. Janine Levitsky.
Well, good morning, everyone.
Good morning.
So good to see you, and thank you all for being here. Still relatively early, even if you came at 9:30. You know, your presence is a testament to your commitment to the MHP mission. Of course, some of you are here for the mission and some for the coffee, but we'll take both. You know, every day our teams meet people who are exhausted, unsure where to go, and trying to manage challenges most of us can't see, nor can we understand. Some are carrying everything they own, some haven't slept. Many have learned over time not to expect that help will come, or if it does, that it would last. Too often, people are passing by, and it's not out of indifference, but because they don't know what to say, they don't know where to start. But our staff, including many peer specialists, do something different. They sit down, they start a conversation, not to fix everything in the moment, but to listen, to connect, and to say, you're not alone, and they truly mean that. And that's where it begins. It begins with connection, trust, and the possibility of something more stable. And that's the work of mental health partnerships. It's why we're here this morning. And I want to start with another word that defines this past year. And that word is momentum. It's not the kind that you read about in a report, but it's actually the kind that you feel in your very bones. This year, we supported nearly 12,000 people, thousands more than the year prior. And that's not just growth. That's thousands more people who didn't have to struggle alone. Momentum looked like showing up wherever people are. We connected with nearly 6,000 people through street outreach, often reaching people during some of the most difficult moments in their life. Nearly 600 received immediate support through our mobile peer support teams, because the right support at the right moment changes everything. And almost 900 came through our recovery learning centers. These are places where people can build community, recovery capital, learn new skills, connect with other health and human service agencies and professionals, and start to see what's possible in their life. We also saw momentum in something just as important, and that was stability. More than 550 people worked with our case managers to navigate housing, healthcare, and other key social determinants of health. And almost 600 were able to focus on their recovery because their finances were being managed with care and consistency in partnership with our representative payee. At the same time, we're building for the future. Last year, we trained over 500 certified peer specialists throughout the Commonwealth. People who bring lived experience into the workforce and change what care looks like from the inside out. And we didn't stop at services. We worked to change the systems around them. This year, our community showed up in a big way for advocacy, including bringing Advocacy Day back to Harrisburg, making sure people with lived experience are not just part of the conversation, but that they are helping to lead that conversation. And behind the scenes, we've also been strengthening the foundation that makes all of this possible, improving how we track impact, building leadership across our teams, and putting our organization on stronger financial footing. In fact, we have gone from a deficit to a balanced budget to projecting a surplus this year. Which I have to say, in nonprofit terms, is basically our version of winning the Super Bowl. So yay Philly and yay MHP. But here's the most important part. Every person we reach and every program we grow, every voice we lift, it all happens because of you, because of many partnerships that we've created with all of you, with the wider community, with our participants, with our staff, with our incredible board. As we step into this 75th year, what excites me most is we're not slowing down. Because together we're building a future where recovery is not only possible, but it's expected, it's supported, and it's sustained. So thank you for being an integral part of that future. And now we'd love you to hear directly from the people who make this work so important, the participants we've worked with over the past year.
If I hadn't come here, I don't know where I would be, because I've had problems with suicidal thoughts in the past, and they bring hope back to you.
Someone to talk to, someone to understand me, someone to acknowledge me, someone to know like when I'm not myself, because like when I come here now and I'm not laughing or joking, like the energy I just gave you, they'll pull me to the side and be like, hey, Ron, what's up? People needing you and wanting you, that, like, you know what I'm saying, that made me feel like, hey, I got this. Like, I got this.
Just take it day by day, because each day is going to be hard. And then, in a good way, be selfish, fight for yourself.
Hopes and dreams just to be stable mentally, emotionally, and this place has definitely been a catalyst for that. I find myself keep coming here because of the staff, because of the programs, the questions that they ask to help me be the better version of myself.
They help me in so many fields of life, different areas of life, and I just pick up on what I need. Socialization, communication, medication, education.
I've been seen, I've been heard, I've been everything. They've just been there since day one, since I walked through those doors. They've been there, and they're still there today. So I'm thankful and I'm very happy.
Having a support system at home helped me a lot also. It's been a great experience.
Getting better and making a life for myself. A lot of my friends were family were very supportive.
You have to want it. If you don't want it, it's not going to work. The more you fight it, the longer you'll stay out there. You have to get acceptance with yourself, your disease, your addiction, your past. Just get through this 24 hours and you'll be okay. And then we'll start again tomorrow.
To stay connected, like, share, and subscribe.
We're also excited to give you a sneak peek at what's ahead. Over the past months, we've been working hard on developing a new strategic plan, laying out our map for what's most important moving forward. And we're looking forward to sharing that once it's finalized later this year. The process to date has been deeply informed by all of our stakeholders, and I want to thank those of you in the room that have been part of the process to date. Your input has been invaluable, and we are energized by what's to come because there are meaningful opportunities on the horizon. So we can't wait to bring you along as we move into the next chapter. Next, I'd like to introduce our Chief Operating Officer, Reggie Connell, an important part of the progress we've made over the past year, to share a bit about what's ahead.
At MHP, we take pride in being innovative in the behavioral health space, identifying where needs are greatest, developing solutions to expand access, strengthening recovery, and creating a lasting impact. This year, we'll focus on 2 areas that represent our future work: workforce development and expanding addiction services. In July, we will launch the Peer Empower PATH program, PATH, workforce initiative funded by the Scattergood Foundation. It is designed to turn lived experience into careers in behavioral health. PEP will support participants in building sustainable career pathways through CPS training, mentorship, specialized career tracks, and job placement. The pilot will serve 20 participants, creating a pipeline of trained, certified peer specialists who reflect the communities we serve and are prepared to support others in recovery. By investing in career paths, we are strengthening individual outcomes, long-term stability of the behavioral health workforce. All right. Just a glimpse into the pilot. We will serve 20 participants, creating a pipeline to become trained, certified peer specialists. We're also expanding our addiction services at Pottstown Recovery Learning Center through the Opioid Abatement Grant. This project will strengthen connections to recovery and treatment supports to participants experiencing opioid use disorder. With the addition of 2 addictions case managers and mobile therapists, we will increase access to addictions case management, clinical support, as well as warm handoffs to trusted providers. This work builds on our existing models and allows us to meet growing needs in Montgomery County on a more comprehensive, coordinated approach. And currently we have that team in place. We call it the Community Outreach Recovery Engagement Team. It's a core team, and they're currently serving 47 participants. So far, like this time last year, they weren't able to serve anyone because addictions case management wasn't available. Well, so far, we've housed 6 individuals in rapid rehousing who are suffering and living with opioid use disorder. So, these initiatives reflect where we're headed as an organization, invested in people, strengthening systems, and expanding access to care. We're excited about what's ahead and grateful to have you all as partners.
I just want to take a moment to acknowledge our senior leaders and executive team in the room, because each of them every day brings 100% of their heart, their strength, and that's how we do this. That's how we make transformation together. I am just so pleased that we've built the level of trust that we have, and I want to acknowledge if our senior leaders and executive leaders could just stand up, I would like to acknowledge you. And also to our board members who have been the thread that weaves through, that really helps us focusing on our future, just supporting us. We need that other level. So thank you to our members. Could you stand up? I want to move us into a fun part of our morning, and that is table discussion. So we have 3 different questions. It's kind of like we go around and everyone comments on the question, 7 minutes per question. Someone at your table on our team will be taking notes, because at the end, I want to hear from you, what is one theme or takeaway or piece of advice that you have for MHP as we move forward in a really exciting time of growth and transformation. So we're going to get started, and Clark will let you know at the 7-minute mark, and I'll see you in 21 minutes.
To stay connected, like, share, and subscribe.